If near-death experiences are just hallucinations, why are entire surgical teams witnessing the same entities simultaneously? These shadows in the operating room aren't just tricks of the mind. They are recorded clinical anomalies that have left top doctors speechless. Today, we uncover the evidence that suggests the soul never travels alone. Imagine this. A patient is on the operating table, their heart stops. They are clinically dead. But then something impossible happens. Not only does the patient later report seeing shadowy figures, but the lead surgeon and nurses in the room see the exact same thing at the exact same moment. We're not talking about stories passed around the break room. We're presenting recent archival surgical logs from 2025 where lead surgeons broke protocol to document these shared visions. Normally, hallucinations caused by a lack of oxygen are personal, chaotic, and unique to the individual. But what we're seeing is different. It's a multi-person synchronized visual event. How can 3, sometimes 4, separate? Highly trained professionals describe the same non-physical figure in a room where only one person is medically failing? The evidence gets even stranger. We've analyzed data points from modern neurological monitoring. In these specific cases, there are unexplained spikes in the heart rates of the medical staff, a collective jump in their physiological stress that coincides exactly with the patient's flatline and the moment the shadow is reported. This is the synchronized ledger, a data trail that links the consciousness of the living to the experience of the dying. We even have documented cases of what's called the third-party witness phenomenon. This is where nurses, on their own, documented seeing spectral movements and described them in their notes before the patient even regained consciousness to describe the very same entity. We're moving beyond anecdotes and into forensic reconstruction, mapping out exactly where everyone was standing and what they saw. So what could explain this? A radical new theory gaining traction is the quantum entanglement of consciousness hypothesis. Proposed in 2026, it suggests that under extreme trauma, the human brain might not just be a receiver, but a transceiver, capable of broadcasting its experience to other minds nearby. This isn't just a psychological event, it's physical. Medical staff involved in these encounters frequently report sudden, measurable drops in room temperature and localized electromagnetic interference with sensitive equipment, all happening concurrently with the shared vision. The focus is no longer just on the patient's dying brain. It's on an external environmental event that affects every single person in that room. Of course, this creates a crisis for the medical community. We're going to explore the immense professional risks surgeons face when they choose to document these impossible events in official hospital records. It's a career-threatening move. We'll investigate the profound psychological fallout for surgical teams who can no longer dismiss the afterlife as a simple, solitary byproduct of a failing brain. They've seen something that shatters that belief. What happens when the most sterile, scientific environment on Earth is repeatedly breached by a persistent, documented, non-human presence? When we synthesize all this data, these surgical logs, the synchronized heart rate spikes, the witness testimonies, the environmental anomalies, a powerful argument emerges. Shared near-death experiences could be the proof we've been looking for that consciousness isn't an isolated process trapped inside our skulls, but a collective field we all participate in. This may force us to create a new medical framework, one that treats these death-adjacent phenomena not as hallucinations, but as a bridge between biological failure and a verifiable external reality. It leaves us with a haunting final question. When the heart stops and the lights of the operating room feel like they're dimming, what truly waits for us in the shadows? Thanks for watching.